All right, we're gonna do our case presentation for you guys. Those of you who want to do smile makeover, it kind of gives you an idea of what is doable. And those of you who want to get a little bit more experience on as far as the dentist wise goes and kind of want to see some cases and how we can change someone's life, that's going to be both kind of going to be touching base on both sides of this for you guys. So in this case, a patient came in with that smile and teeth and wanted to have his life changed because it was affecting him not smiling and being self-confident. And also his other concern was he couldn't function. If you look at here, you can see we're missing teeth on the left side, and then on the right side we can't function. So that was bothering him. And as far as aesthetic wise goes, you can see the wear on these front teeth, you can see the crack lines, you can see discoloration, and all that combination was something that he did not like it at all. So my first conversation with him was I had to narrow down what is his vision in the next 2, 3, 4, 5 years to get an idea of what we're looking for and what can we do to help him. Sometimes patients like this come in and they're like, I'm done with my teeth, I just want to go with dentures. And sometimes patients like this come in and they'll be like, I want to save as many teeth as I can. What can you do for me? So if you go to his panel, you can see there is a multiple areas on each quadrant. You can see missing teeth. Sometimes you can build patients bite from premolar to premolar and they can function just fine. So on the lower right that we have a big deficiency, I'm not too much worried about that area. This area, however, upper right, upper left, and lower left, we have some room that we can add some teeth there for him. So when we treatment plan this, put in a plan for him to actually place a couple implants on these upper right, do a couple more on the upper left, and one down here to give him the function that he's looking for. And then during that process, we came up with a plan to balance his teeth and align these kind of more square shape, straighter formation there, and be able to make these more symmetrical, you know. So, and based off of these two relations, we came up with smile design for him and got all of these into perspective of the final, which is something to that nature what you're looking for. So there's a lot of designing and planning goes on before we can get actually to this stage. And the designing and planning, everything starts with a wax up. Take the models of patient, look at their smile line, see how high their lip is, how much retraction they do, where lower lip rests when they smile, and then based off of the lower lip, you can start planning on the front two teeth, kind of like how you put the dentures together. So you look at the front teeth, you place them where they need to be, and then everything else goes based off of that. Once you put the teeth where they need to be and they belong, then you look at the function, and then you look at the biology, look at the location of bone, gum, and how can you work around that to match it. For instance, if you're gonna put teeth here and you want them this far out, where are you gonna put implants or bridge here to push them that far out so it would make sense, basically. That's how you put that together. So in his case, what we did is we took some models of his teeth, we did a wax up. On the wax up, originally these teeth were shorter, so when I looked at him and looked in his mouth, they were not matching as far as the length where we want them based on the lower lip length. So I had to send it back and ask lab to make him longer and create the symmetry that we're looking for on both sides so we can achieve that. Number two, the second part of that is your patient's lower teeth. You can see the wear on and unevenness on these. So sometimes patients come in and they're like, just fix my top teeth. I can only show my top teeth. I'm not worried about my bottom teeth. So the problem with a case like these is you fix the top teeth and you make everything align in perfect alignment, and you don't touch the lower because patient wants to save money and doesn't want to spend as much. The problem is when you deal with a lower that's all over the place and you put an upper that's more aligned, this a straight line hitting all over the place, patient runs into functional issues and will start chipping and breaking things. And then you can't put your hands down. I can't find one area that's a problem. Well, because there's multiple areas, and once they hit, once they break, not hit, once they break the area that's the highest, then they will go after the next and the next one. So for instance, on this case, if you would have done anything to lower, patient would start chipping the front teeth right there on the 8 and 9. So the coordination between this area and then next would have been this area. And then once you flatten these two out or break any coordination, any intervention on this side, you will go actually after this. So you flatten this either by flattening this bottom or breaking the top, and then you go after that part. So sometimes in cases like this, it's not about saving patient money per se. It's more what's ideal, what's functional, and what's going to get patient to have that ideal smile, but also something that's going to function for them for a long term. So going back to the panel, the challenges we had in this case were, one of the main challenges were we had broken tooth here we had to remove and place an implant. We had very narrow bone on the upper right that we had to figure out how we're going to place the implant into that area in order to get the alignment based on these teeth where they need to be. And then lower left, we had that broken tooth that is sitting right next to our mental frame in there. So we had to kind of stay away from that area and figuring out how we're not going to get resorption there to place an implant right next to it and not hit the nerve. That was another challenge we had. Now, putting all of this together, we came up with a smile design for the patient and put that together on the wax up. Patient came in on the day of the procedure. Patient comes in, will numb basically all the upper and lower, and once we numb him, we go in and start prepping the teeth based on the wax up. When we prep the teeth, we look at the wax up model, which are these, and we know where the teeth are going to sit. Based on this, we'll remove that much tooth structure. For example, this has a nice length to it. Basically, we're bringing these upper teeth to somewhere like right up here. So if we're adding that much length, we don't need necessarily to take too much of tooth structure here off. We just take enough off to compensate for that, okay? And then the smile line goes somewhere like there. So like this area, because it goes below it, we have to shave extra off to be able to gain that nice even smile line all the way for patient. We did go ahead and remove this tooth because that's the one that on the panel you could see that it's broken, and then we placed a bridge on this area to fill that area in, and then we placed 2 single implants there and 1 implant here. The function right here was totally fine. We did not have to load all the way back here because that would not be sufficient enough due to some bone issues we had on the back area there. So let's zoom in on this part of that, his front teeth, to kind of look at together. Ideally, we would want to have maybe these gums come a little bit higher to balance with these, but then that would have created these teeth to be longer. He had a low lip line. Due to having a low lip line, when he smiles, he lands somewhere around this area. As a result of that, anything above that will not show. Especially these back areas, we had some implants placed in. So due to having those implants on the back area, we did not have to worry about any kind of resetting of the gum to bring those up to make it more alignment. Number 2 is patient did not want to go through extra surgery to move the gums up higher. He wanted to get fastest turnaround possible and still look really nice, which we got pretty good results comparing to what he had initially. On the bottom, you can see that this is what I was mentioning earlier about the alignment and functionality between the upper and lower. You can see when you're aligning these uppers and then you're aligning these lowers, they need to be even to touch each other in an even manner. And if they're not, if some of these are upper and some of these are even compared to these being up and down, it's going to create that unevenness that patient will start breaking different areas and hit him into each other. Last but not least, I'm going to go over this last part of that is the panel. I want to make sure you guys pay attention to all the details. When you see a case like this, do not go automatically to all-in-4, or do not go automatically to let's pull all the teeth and move on with dentures. Sometimes you can save patients' teeth, because if that's what they're looking for, and if that's doable, we need to look as clinician what patient wants, what their issues are, what their concerns are. Make sure you're taking time with big cases like this and dig deeper as far as patient's chief complaint and deliver based off of that, and not have one type of treatment fix it all for all the patients, you know. So always make sure you're considerate of patients' needs, patients' concern, and chief complaint. I think that would be my main suggestion, because you'll be surprised a lot of people who let their teeth go for so long and they look like this. They not necessarily wanted to do that. Something in life or things that were going around life put them in situation to not take care of their teeth as much as they needed to. But now that they want to pay attention to it, they don't have to necessarily go with dentures. Last but not least, you're probably wondering about this little tooth back here. That tooth, we did not have to build it up or do anything to it. It was sitting there just fine. We removed the cavities on that tooth, but we just left it so that it will stay there instead of taking it out. There was no reason to take it out. I know there's no teeth above it, but there was no infection. There was some cavity, we just cleaned it out. It was not showing in any of the smile patients, basically smile. So we just left it there for patient and didn't have to remove it. So if you're wondering what's going on back corner, that's the last area of patient's thing that we just cleaned it up, got the cavity out, and just left it the way it is. This concludes our smile makeover presentation and how we approach this case to fix that. If you have any questions, write in your comments, reach out to us. We'll be more than happy to help you with it and get you going. Thank you.